my life I had.
What's going on? This is Kevin Holt here with BallHer Hoops. Bring you another episode. Excited. We got Coach Gibson with us here today. And then we got a special guest, Marcus Gaddy. Marcus Gaddy works with the youth with mental health. He's a psychotherapist, correct?
Yes, sir.
All right. He's a psychotherapist, and he's going to give us out some good information. We're going to ask him some questions. But first, I want you to let you introduce yourself. So you got the floor. I'm going to mute myself just so it'll be all for you.
Most definitely appreciate it, Coach. Marcus Gaddy. I'm a licensed clinical social worker. I'm in my last year of supervision, so I'll be fully licensed this summer. Started off working with just straight youth, coming in doing intensive in-home, which is like one of the highest level of therapeutic services outside of hospitalization for children. So the highest level of therapeutic services children can get. So just with that, I took, just working with kids, being a male in a profession that's mostly females. I used to get a lot of the kids that, were males, young Black kids. They would bring them to me just because they were more comfortable working with me because I look like them. So I just took a concept called playground therapy, something that I just created because I was just like, well, since we together, let's go hoop, let's go to the playground, let's go throw the football while we're doing these therapy sessions. And it started to work and it started to get a buzz. So from there, I just kind of took that same concept and wanted to focus more on like athletes, student athletes, collegiate and high school athletes as well.
All right, I love all that because it's always good to give back to youth. I know with myself and Gibson, we are both teachers and we work in the school system. So I know what the school I'm with is a lot of people that look like me. So either way, it's still great to have you here. We're going to get to a couple questions just to go ahead and get it started because one of the reasons I wanted to do this is because a lot of stuff has been going on with like college athletes lately, especially like I want to say last week, the cheerleader from Southern University ended up taking her life, and you never know the pressures that these young athletes are going through. And it's crazy because, you never have that person to talk to because you never think of it like as a real issue. So I just wanted to get a couple questions out here, and there might be some questions that some of the parents have had or just we thought of ourselves. So let's go ahead and get that started. So the first question we had, what's the most common mental health diagnosis that you are seeing among youth and amateur athletes?
I would say right now, the most common would be ADHD and or adjustment disorder. And here's why, because a lot of, we therapists, we go off the DSM. So a lot of those kind of like bipolar or more detailed diagnosis, you can't really diagnose a child or like, a teenager or high school until they turn 18. So for the most common that we're seeing amongst athletes is that ADHD or adjustment disorder, just meaning that they've been through some type of trauma and now we're seeing the results of that trauma.
So that's what is you said the DSM or DSM?
Yeah, DSM. It's just like it's pretty much, and this is, I don't say this, but some people call it the Bible of therapy because it gives us the guidelines of all the diagnoses, what to look for, how many you might have 5 symptoms. It's like a checklist. You might have to hit all 5 of these symptoms before someone can officially diagnose you with this mental health disorder or eating disorder. So pretty much just the guideline that all therapists from LCSWs to mental health, every mental health professional has to go by.
Okay.
Just a quick question asking about the book, Kev. Did they update it? I know that I did work in mental health for 14 years, and one of the biggest things now is like the social media impact and the diagnosis that they've seen come from there. So I was just curious to have they updated that book recently.
Yes, sir. Actually, I want to say last month they went to the DSM-4 to DSM-5.
Okay,
or like
yeah,
5,
right.
Another version. It's like a blue. Mine was purple. It's like blue now. I can't think. It might be 5.5 or something like that. But every year they update it to just go along with the times. Just a lot of stuff that's going on. Like a lot of diagnoses from probably 1991 gonna look different from 2022. So every year they do diagnosis, and they getting that bread too, because that book like $250. So you got to buy that book, you know, and they got to get their money too. So yeah, definitely they updated.
Okay, yeah, you know they're gonna get their money. That's what they're gonna do. So anxiety and depression are commonly found in elite athletes. There's been a lot of cases to where these two have been polarized because a lot of people are going through them. What other major diagnoses are not as commonly recognizable, but can still be detrimental?
Man, substance abuse. A lot of substance abuse disorders, like the cannabis use disorders, the alcohol use disorders, are extremely common amongst especially our high school athletes, even our middle school for sure. Like I've been the vaping, that's becoming a little bit more popular now, you know. But definitely I think that is something that kind of gets overlooked, the substance abuse diagnoses amongst our athletes. Because I did my internship at North Meg, and when I tell you it was times, man, where the hallway smelled like a dispensary, for sure. Like it was just common though amongst them, and that's just what, you know, they do. And it was just being a social worker working on that side, seeing some of the people who were had to go through the substance abuse. CMS got like a substance abuse program that you have to go through if you get caught smoking or something like that, where you have to work. And I've seen like a lot of athletes go through that program as well. So definitely I think that's one of the most common ones.
I like that one because that's definitely, I would think, a lot common, because me and Gibson actually were just talking the other day, and we were talking about how athletes get caught up with the substance abuse. So that's funny that came up. This is probably one of my favorite questions. Overall thoughts on early sports specialization. How does a youth athlete find balance, and how does a parent recognize the need for balance?
Definitely a tough one. Being a dad, both of my boys are in sports right now. It's hard. It's definitely hard. I think a lot of the times, we all want our kid to succeed, especially you guys are coaches, so you guys see it from a totally different lens than like a parent would, right? But you know, sometimes we get so caught up in parenting to where we try to put some of our wants on our kids. So I think just addressing, like making sure that your kid wants to do this sport. That's the thing, because a lot of the pressure comes from they're trying to please us instead of actually enjoying what they do. So just making sure that, you know, as a parent, for sure, just making sure that you're checking in with your child. And the balance, man, I don't know if I had an answer to that question. The balance is, it's always gonna be tough. Being a student athlete, for sure. Just the pressures on and off the field. But definitely just the self-care part, man. I think just having that self-care component, and knowing that when it's enough, like saying that you need a break. You might not go to practice today, talking to your coach why, what's going on, and not just trying to be Superman and carry all the pressures of on and off the field struggles with you, man. Especially as a middle school, high school athlete. I think the pressures are a little higher in those areas, but just having that self-care, taking care of your mind, your body, and seeking out when you are struggling with certain things.
All right, that's perfect, because we think about athletes, we don't really think of the whole picture. Like those expectations are for athletics. Like I know we call them student athletes, but a lot of times we forget how much pressure they are to be that athlete. Because I mean, if they're not that person, then who are they? That's right. Sometimes what they are looked at as. So one of the questions I had, do you feel the pressure of being a student athlete compared to being a regular student makes for a harder task for the student athletes?
Oh yeah, definitely. Like you just said, like sometimes our student athletes don't have an identity outside of athletics, because athletics for some has carried them through, you know, their academic journey. You know, it gave them that purpose, their identity. So you take that athletic part away, you know, they might struggle with that other identity of just being a student. So I think the student athlete definitely has a lot of more pressure than, you know, a regular student. And that's just my opinion. I believe so, just because of the expectations of once you get into like that high school and college, it becomes a job. You know, you're playing for a scholarship. You're playing for those stars, those 5 stars, or whatever the high school rankings are. That's a lot of pressure, man, to keep on. And a lot of those people are coming from environments to where they feel like this is going to carry me out. This is going to get my parents out of this neighborhood. This is going to get me out of this situation. So that's definitely a lot of pressure.
I like that point, especially about the trying to get yourself out of a situation. I think a lot of times we get athletes, and just from experience, like with coaching with Team Curry, we have girls that's like big time athletes, but you would never know them outside of basketball. Some of these girls really have some things that they really have going on that you would never know because all you see is the highlights or the game film, and that's what they're known for. But they're still people at the same time, and we all have our own things that we go through. Coach Gibson, you had a question. Do you have any question? Did you have a question?
Right. No, I was actually just sitting here thinking about some of the things we were talking about, man. And I did want to know, like, if you had one thing that you want to tell parents, like, watch out for this. We're talking about, a lot of the kids and the pressure that they feel. And a lot of times when I had a kid grow up in this thing, and what made it hard to communicate was that letdown, that feeling of letdown, you know what I mean? So what is the one thing, maybe a parent can just try to, of a million one things, like withdrawal, for example, what is the one thing you would say, hey, parent, make sure you watch out for this in efforts to find that balance or when needing that balance or whatnot?
Just, I would definitely say just making sure that you check in and communicating. Like if your child is not really communicating, kind of isolating themselves, not nonverbal a lot of the times, you see a decrease in interest in certain activities. Like, if they like going ice skating, all of a sudden they don't want to go ice skating no more. They kind of just in their room. Definitely that's like the number one symptom that you start to see is like withdrawals. Because, with depression, that's a common symptom, and anxiety, like you just don't want to be bothered. You just want to be to yourself. And also irritability. Like if your kid is getting like things that wouldn't get them that irritated, starts to get them that irritated to where their behaviors are becoming aggressive, like verbally aggressive and things like that. Just small changes in behaviors and just knowing your child, like, and then that's the time you want to just talk to them, get them that, that support. Or if you feel like you don't have the words to talk to them, go get some outside help. And sometimes, as parents, we could be prideful and be like, well, I don't need nobody to help me be a parent. I don't want nobody to help me. Like just being able to say, well, if I can't, help this child, maybe somebody else can. So just being able to do those things.
Okay. I think I got probably one or two more questions. So how can mental health affect athletic performance?
Big time, man. Big time. I've seen some, and not to bash my man. Like I've seen some big time players like Kevin Durant, like just these last series, man. Like just the pressure of being overwhelmed with just like what's going on, man. It could definitely decrease your performance because you got to think about it. Like if you're not checked in mentally, like I don't care how good of a performer you are, like you're not going to be able to perform at your highest level. I'm not saying that you can't, you still can't, but you're not going to be able to perform at your highest level. So I think just being able to have a clear head and just certain things that you need to do to be open, like vision, like awareness, all that stems from mental health. So I think it's a very important part of performance for sure.
Okay. All right, this is the last question that I have. Biggest advice to athletes or coaches or parents regarding the onset of mental disorders and treatments in sports.
So you said like the biggest, you said it one more time?
So the biggest advice you could give to them those onset.
Definitely. Like I said, therapy is not, a lot of people think therapy is for the broken, and it's not. Like, I mean, you could be, I think it's just for anybody that just needs extra support. And you could be in a great space and still have a therapist. I think like any kid that goes through, athletics for sure needs to be linked to some type of therapist. And it could be a specialization like a DBT, which is like a dialectical behavior therapist. And all they do is work on like mindfulness, like how to be present in the moment, your breathing techniques, yoga, guided meditation. Those are just things that keep you from just, sometimes we live on autopilot, where you just so used to just Yeah, you ever been driving and you just ain't even really thinking, you just automatically know the route. You're on autopilot. Like I think sometimes, like, and that's not a good way to live because you get caught in your thoughts, you get caught in routine, and you're kind of not living in the present moment. So DBT teaches us to live in the present moment. That's one of my favorite interventions and tools to use with athletes. And I think if you're an athlete, you perform on a high level, or you feel like you want to go professional, I think definitely being linked to like a therapist, any type of therapist, would be helpful.
Coach, you got anything else that you wanted to ask?
No, I think he covered a good array of things, man. I know, with youth and sports, man, mental health, I've, like me and you were talking, Kevin, I thought it was a big overlook with me doing therapy for a long time. I know that pressure of needing therapy for yourself when you're dealing with the youth. So I know how important that self-care is and how we teaching it to this youth. And do you think that it's obviously we need more awareness? Would it be more beneficial to have it or require it at the high school level?
It would be extremely beneficial. I know a lot of CMS, they do have like school-based mental health, but it's like you have to be in some type of distress, like either behaviorally or something had to happen at home. But I think it should just be somebody there that's chilling, that's like open door policy. Like if you need to just check in the day before the game, to just talk to somebody to say, hey, I'm stressed before this game. This is a big game for me, and just to process with you before the game, like I think that resource would be very, 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 very necessary in the school systems. Definitely in the collegiate for sure. I think they do have it. I remember talking to Coach Woods over at UNC Charlotte, and she was kind of like put me on game on like how that they let the girls there kind of talk to like a sports psychologist and to keep them balanced mentally and things like that. So I think high school definitely needs it. For sure. And if you can't afford it, like it's so many mental health agencies that do like pro bono work, IPS funding. So it's so much out here, man, that if you don't have insurance, they can still get you linked to a therapist. Just definitely go out and seek, and you'll definitely find what you need.
Gotcha.
We definitely appreciate you, Marcus. This was honestly one of the bigger things for us this year, because mental health right now at us is like huge, because so many things are going on with our athletes that we just want to catch before it gets to a certain point to where you're no longer able to catch it. So I appreciate you being here. Coach Gibson, thanks for being on again. Just making sure that we are giving our girls our flowers in more than just basketball. I think I just posted life is more than basketball. Honestly,
definitely.
We got so much more. You're more than a basketball player. So I appreciate you, and I appreciate everyone that stopped and listened. Thank y'all, and BallHer Hoops. See you again later.